have the same type of symptom. For example, if somebody has breast fibroadenoma, that's in medical terms, they say it is benign. When something is benign, it means it is non-cancerous. It's possible for a woman to have a swelling in her breast and it is not cancerous. So if you see a doctor, they will probably take the sample for biopsy and will know if it is cancerous or not. They'll say it is malignant. So if it is benign, it means it does not contain cancer. But if it is malignant, it contains cancer. Sometimes some women have mastitis also, which is the inflammation of the breast. It occasionally occurs as a result of infection, especially in women that are breastfeeding. So if you have all of these symptoms, don't just conclude that it is breast cancer. You must see a doctor so that they can properly examine you, and if there is need, send you for biopsy and be able to diagnose if it is cancer or not. So let's move to the causes of breast cancer. What are the causes? Research has not really told us that this is a particular cause of cancer. Researchers are still working on finding a definite cause for it, but there are just factors that researchers have identified that if there are three in number. We call them hormonal, lifestyle, and environmental factors. These three factors are the risk factors that I will highlight them shortly. That if someone are under these factors or have all these experiences, it is possible for the person to have breast cancer. Unlike some diseases that we know, like the HIV, hepatitis B, we know the certain, even for coronavirus, we know that, okay, this thing is caused by a certain type of virus. But for cancer, we don't know. It's just some cells misbehaving. So they can't, science has not been able to say that this is particular. But I would list these factors for you. Number one is heredity. There are tendencies that if someone in your family or in your lineage, maybe your grandmother, your aunt, your mom, or somebody in your family has cancer, any type of cancer or breast cancer per se, you might be at a higher risk of having it than someone that they don't have it in their family. And about 5 to 10% of all breast cancer cases are linked to two types of gene. We call them breast cancer gene 1 and breast cancer gene 2. People that have this gene are having breast cancer. So there are other risks like increased age. As women increase in age, there is increased tendency that they would have breast cancer. Also, people that have had history of condition that concerns the breast. For example, people that had a lump in their breast while they were young, or people that have the fibroadenoma I mentioned before, or breast papilloma. People that have had all these conditions that affect the breast that are not cancer, it's possible for them to live breast cancer. They are at a higher risk of having breast cancer. Another factor is exposure to radiation. People that have been exposed to radiation, for example, have had treatments that includes radiotherapy, or people that have been exposed frequently to X-rays. Such women are also at a higher risk of having breast cancer. Another very important risk factor is obesity. People that are overweight, people that are obese are at a higher risk of having breast cancer too. That's why I tell women to always watch their weight. I'll talk about that much later when I'm talking about the prevention. Also, women that begin their menstruation at a higher age, especially those that begin their menstruation before the age of 12, they are at a higher risk of having breast cancer too. Also, people that have their first child after the age of 30, research has shown that some people are also at a higher risk of having breast cancer. Also, people that have never been pregnant, women that are in their 40s, 50s, that have not had children, they are at a higher risk of having breast cancer too. Then lastly, another risk factor is the intake of alcohol. In fact, I would like to dwell a bit on this because talking about alcohol intake for women is a no-no for me. Some people say that they should reduce the intake, but I advise that women should run away from alcohol, not even because of breast cancer. It's because the female body is not does not like alcohol or cannot condone alcohol like that of males. It's bad for males too, but it is worst for females. I spoke with a patient of mine about 2 weeks ago, and someone at the hospital in Lagos sent her for some tests. And when the results came, they found out that her liver has been damaged. So I was asking the fellow that referred her about trying to gather a medical history, and I asked if she had tested for hepatitis B because that can cause liver damage. And the person said no, that the person is hepatitis B negative. So I asked if she takes alcohol, and she funnily said that if they go to parties, that this woman, they call her Beauty, that she can drink as many beer bottles as possible, and now it has affected her liver. So I categorically advise women not to take alcohol at all if possible. But if you must take it, make sure that it is very minimal, because intake of alcohol, it is a very big risk factors when talking about breast cancer. Then I would also like to talk about smoking. Smoking is also a big risk factor talking about breast cancer. And there is a trend in Lagos, in Nigeria now, where I see women, maybe they are at a party, or some people have this thing in their home, shisha pots here and there, and they do it as if it is what defines you as a big girl if you are smoking shisha. And I hear some people say, it's not cigarette now, it's just that I'm puffing it like this and I'm spitting it out, that it is less harmful than cigarette. But I tell you that shisha is even, if not more harmful than cigarette, because it contains toxins that are very dangerous, very injurious to your health, and it is a leading cause of leading risk factor talking about breast cancer. So round off my seminar with the key points about preventing breast cancer. This is the reason why this seminar was organized. And the first point I would like to make is that women should endeavor to keep their weight in check. This is very, very important. Keeping your weight in check as a woman is very important. It is not because of body shamers, but it is for your own good. There's a trend in Nigeria now where if you tell a woman that she's getting big, she would say you are body shaming her. But I'd like you to know that the slimmer you are, the healthier you are. So it is very important for every woman to keep their weight in check. And what are the factors responsible for that can make a woman get obese suddenly? Food is number one. Check what you eat. Check what you eat. I read a Chinese maxim that said that what we eat might later turn around to eat us up. That is, if you don't watch what you eat, those things might later eat you up health-wise. So we copy the Western culture of eating junks. And it is becoming something that is disturbing for me. Like, if you take our own African food, people see you like you are not the happening person until you take Western foods that will make you obese in a short while. Taking junks, food that are inside can, food that has been processed. We want to eat food is ready. How did they say it? Food that you prepare within 3 minutes, 4 minutes, and it's already done. But it is very important to stay away from junks and eat proper food, especially eating them in the right proportion. It is one thing to eat. It is another thing to eat right. Eating right includes eating at the right time. I wonder what a woman is doing, eating anything after 7 p.m. at night. Breakfast is the most important meal of the day. If you take something light for breakfast and you take a proper lunch, like food that is made of little carbohydrates, adequate amount of protein. When I'm talking about protein, most of us prefer to take red meat, and we carry a big bowl and pack plenty meat, a body, shaki, orishi.
Yeah, hi guys. Yeah, I guess Dr. Omomurewa is having issues with his connection. I don't know, but if you have questions, you can drop in your questions for him through the chat button. If you check below, you can see the chat button. Just drop in your questions and we'll get to answer them. Yeah, thank you very much.
Okay, thank you, Dr. Alasa. As I was saying, I was talking about food. So you see somebody that wants to eat a small portion of eba, and there's a separate bowl for meat. You have a body roundabout, different type of meat, and you are eating it, and you are even using it to show off that wow, that is eating wrong. If you must take meat, red meat should be minimal. If you must take it at all, then more preferably you should take chicken or turkey without the skin. The skin, that part of chicken or turkey that has that outer portion of the skin, it is not good for consumption. Contains a high level of cholesterol. So if you must eat, you should fill off that outer part.
So if you're supposed to be talking about environmental
Very
things,
good for you to eat as adults is
wow.
fresh fish, but I don't advise you to take too much of fried fish because the oil in which you use to process, especially most of the vegetable oils we use, contains high cholesterol also. So basically, smoked fish, boiled fish, is good for your health. And then about food also, most of us hardly take fruits and vegetables, which should be a very basic part of our diet. At least one should try to take between 4 to 5 servings of fruits every day, different fruits. At best, you can have a fruit salad you prepared yourself. If you must take juice. We all have blenders at home. You can get oranges, get apple, get banana, and blend them and take. I think some people call it smoothie. It's better for you to take that than take processed juice that have been that has additives, that have preservatives, things that are not good for your health. So the best type of food are foods that are natural, that has not been processed. You must take juice. You can prepare your juice yourself at home. You can get your blender, get whatever fruit you want and blend it. Then you take it fresh. You can refrigerate them. So that's just talking briefly about healthy diet. What you eat. Remember what I said before. What you eat might later turn around to eat you up if you don't watch it. So that's all about food. As I mentioned before, a key preventive measure to preventing breast cancer is avoiding smoke. Do not smoke. Smoking is injurious to your health, whether as a male or as a female. Smoking is a no-no. It is injurious to your health. I would also like to mention about being physically active. It is a key preventive measure also to be physically active. It is not compulsory to go to the gym to be physically active. You can take a 5 minutes walk daily. That distance that is not far, that you take bike or you drive, you can decide to just walk. You can skip in your house. You can do sit-up. You can do little exercises that would help you stay active, help you burn fat. Those of us that have children at home, there are errands you send your children that you can go by yourself. You don't eat the gym to be physically active. You can do 1 or 2 exercises in your house that are not too strenuous, because too much strenuous exercises can even affect your health. So you can do little exercises at home. Just move your body. Let your body move. Let your cells work. Put your body to work so that you can lose fat. You can burn that fat that is trying to generate your body. Lastly, I would like to talk to people that have a history of cancer in their family. If you know that there are people in your family that have had breast cancer or whatsoever form of cancer, you should pay much more attention to your health. You should endeavor to do medical checkups at least once a year, a comprehensive medical checkup. Not even for only people that have history of cancer in their family. Everybody should do a check once in a year, so you know the state of your health. But I don't know. In this part of the world, we don't pay much attention to our health. We use the cure system instead of the preventive system. And the preventive system of healthcare, wow, my light is out. The preventive system of healthcare is cheaper. That's one truth that I like to tell you, that if you go by the measures you are supposed to go by, if you do everything you are supposed to do, and you check regularly, you do check up, go to the hospital, they do proper health check for you, then you are at a lower risk of having certain diseases that might later cost you money. Cancer that I'm talking about is they call it disease of affluence, because you really require money to manage cancer. If you know how much